You may have just been given your first prescription for a psychotropic medication. Psychotropic is a general term for medications used to treat mental health conditions. Or you may be going through what feels like your 100th prescription change. Maybe you're discouraged with side effects or lack of improvement, and you've decided to stop taking medication as part of your treatment. It's not uncommon to be prescribed a variety of medications throughout a lifetime. Not all medicine works for everyone, so there's often some trial and error before finding a solution. It may take a combination of medicines to treat symptoms and side effects. Fortunately, there are a variety of effective medications available. Jose has decided to talk to his pharmacist to learn more information about psychotropic medications, how they work, and what options are available. She begins by telling him about medications that are often prescribed for depression. Typically, the first class of medications used to treat depression are selective serotonin reuptake inhibitors, or SSRIs, and selective norepinephrine reuptake inhibitors, or SNRIs. These medications increase the levels of neurotransmitters in the brain, allowing positive emotions and messages to pass through. Jose mentions that he has heard there are a lot of complaints about dry mouth, weight gain, and sexual problems from people taking SSRIs and SNRIs. The pharmacist explains that many side effects go away after a few weeks. If side effects do continue, changing medications or dosage can often resolve the problem. Stopping this type of medication abruptly can result in very uncomfortable side effects. Whenever stopping an SSRI or SNRI medication, it's necessary to work with the prescriber to taper off the dosage while brain chemicals get used to the change. SSRIs and SNRIs have a lower risk of being fatal if taken in overdose. Next, she talks about tricyclics or TCAs, older medications used to treat depression. They are still used today when SSRIs and SNRIs fail to work. They have additional side effects, and overdoses of this type of medication can be deadly. Like most antidepressants, these drugs can take 2 to 4 weeks to start working and 2 months or more to see full improvement. MAOIs, or monoamine oxidase inhibitors, have a long history of use as a treatment for depression. These medications have few side effects, but they have some serious problems all their own. If people taking these drugs eat certain foods, they may have a severe spike in blood pressure. One method of delivering MAOI medication is through a transdermal patch. Applying a daily patch doesn't appear to cause the spike in blood pressure and doesn't require any dietary restrictions when used at the recommended dosage. Starting a new antidepressant medication may trigger a manic episode in someone who has undiagnosed bipolar disorder. It's important to let your provider know how your body reacts whenever you start a new medication or when medication dosages are adjusted. Next, Jose learns about antipsychotic medications. Antipsychotic medication reduces or eliminates delusions and hallucinations. The term used to refer to the older antipsychotic medications is first generation. They are less sedating and are available as long-acting injectables that can be given every 2 to 4 weeks. Long-acting injectables are especially helpful for people who have difficulty remembering to take their medication, are unable to absorb the pill forms, or simply prefer this option. One of the challenges with antipsychotics is that they can affect neurons outside the brain that move muscles. This can cause movement disorders such as tardive dyskinesia, which is an uncomfortable condition in which the brain misfires and causes random, uncontrollable muscle movements or tics in the arms, fingers, legs, toes, or facial muscles. Talk to your doctor if you experience these types of symptoms, as they can become permanent. Newer, second-generation atypical antipsychotic medications are more likely to result in weight gain, which can cause serious cardiovascular risk. People on these medications put on weight due to sedation, appetite stimulation, and and inability to feel full. Jose asks about medications that are commonly prescribed for bipolar disorder. Mood stabilizers are the most common medications for treating the mood swings associated with bipolar disorder. There are also medications now approved for use as mood stabilizers that were originally created to treat seizure disorders. These are known as anticonvulsants and can prevent highs, both manic and hypomanic episodes, and also prevent lows or depressive episodes. There is one more category to tell you about, and that is anti-anxiety medication. Anti-anxiety medication works quickly and is very effective in the short term. However, people prone to substance abuse may become dependent on some of these medications. Jose is amazed at all the options that the pharmacist has readily available, but he wonders if there are any new drugs in development. The Food and Drug Administration, or FDA, regulates all prescription medications available in the U.S. The process of getting FDA approval for a new medication or for an old medication to be used for a new purpose is very long. It can take years. However, physicians often find that although a medication hasn't been approved by the FDA for use with a particular condition or for a particular group of people, it has been shown to be effective in clinical practice. This means that the FDA doesn't have conclusive research to show that it works, but the physician has experience that indicates it does. Rather than wait for FDA approval, the physician has the authority to prescribe that medication anyway. This is called off-label prescribing. This happens often in the medical field because, in order to help their patients when they need it, caring practitioners often can't wait for FDA approval for every possible condition. You should also be aware that generic medications and brand name medications are not exactly the same. While the active ingredients are the same, the inactive ingredients can be different. The inactive ingredients can impact how the medications work for different people. For this reason, if you've switched from a name brand to a generic and notice changes in symptoms or side effects, talk with your provider. The future of treatment for mental health symptoms is hopeful. Scientists are learning more every day. Research is now concentrating on understanding changes that happen within our cells, believing a more effective target for drug action may be revealed. You may want to do some research yourself and read about other new discoveries that may change the future of psychotropic medication options. NAMI's website is a great place to start. Jose feels encouraged. He now has a much better understanding of how psychotropic medication works and how many options are available.